Every year, thousands of Indian students pack their bags and leave home with one dream: to become a doctor. When medical seats in India are limited and expensive, studying MBBS abroad seems like the perfect solution. Countries like Russia, Ukraine, China, Philippines, and Kazakhstan promise affordable medical education, easy admission, and a bright future. But behind the glossy brochures and promises, there is a side many students discover only after they arrive. The first shock usually comes from the education system itself. Many students expect a global standard medical curriculum, but reality can be very different. In some universities, language becomes a huge barrier. Even though courses are advertised as English medium, many lectures, hospital interactions, and patient communications happen in the local language. This makes clinical learning extremely difficult. Imagine trying to understand a patient's symptoms when you don't even understand the language they speak. Another major challenge is clinical exposure. Medicine is not just about textbooks. Students must interact with real patients. However, in several foreign universities, especially in smaller cities, students report limited patient interaction. Hospitals may not allow international students to participate actively in treatment, which means less practical experience. Then comes the cultural and lifestyle shock. Moving to another country at 18 or 19 years old is not easy. Students suddenly face freezing winters in places like Russia or Ukraine, unfamiliar food, loneliness, and homesickness. Some struggle with mental health because they are thousands of kilometers away from family. But perhaps the biggest hurdle appears after graduation. To practice medicine in India, foreign medical graduates must pass the Foreign Medical Graduate Examination, FMGE, conducted by the National Board of Examinations. This exam is extremely challenging. In some years, the pass rate has been below 20%. That means out of 100 students who study MBBS abroad, only a small fraction manage to clear the exam and become licensed doctors in India. Many students spend years trying to clear this exam, while others give up their medical dreams altogether. There is also the hidden financial burden. Agents often advertise MBBS abroad as cheap, but once students arrive, additional costs start appearing: hostel fees, visa renewals, medical insurance, exam fees, and living expenses. Over 6 years, the total cost can reach 30 to 50 lakhs or even more. Another issue is misleading education consultants. Some agents promise guaranteed success, top universities, and easy licensing. But in reality, students may end up in universities with poor infrastructure or weak academic support. Once students realize the truth, it is already too late. And sometimes, the problems are even bigger. During the Russia-Ukraine war in 2022, thousands of Indian MBBS students studying in Ukraine suddenly found themselves trapped in a war zone. Many had to escape through dangerous borders, leaving their education incomplete. It was a harsh reminder that studying abroad also comes with geopolitical risks. But this does not mean studying MBBS abroad is always bad. Many students do succeed and build successful careers. However, the journey is far from easy, and the reality is often very different from what advertisements show. So before choosing this path, students must ask the right questions. Is the university recognized? How strong is the clinical training? What is the FMGE pass rate? And most importantly, are you ready for the challenges ahead? Because becoming a doctor is not just about getting admission. It's about surviving the journey. And sometimes, the hardest battles are the ones no one warned you about. Welcome to D Block. It's not conspiracy, just reality.